and welcome to the Module 10 video review, Chapters 40, 41, 42, 43, and 44. Okay, so let's just really quick talk a little bit about just culture. And this is a system based on our attempt to avoid punitive consequences for everyday actions or mistakes. A lot of this is focused around safety, but we use it for other things as well. And the system really does work pretty well when it's utilized by those who have honesty and integrity. But excellent for safety, excellent for education, just really overall a pretty good system. Driving the ambulance, it is important to know that we are still required to follow laws, regulations, and ordinances. Sure, we have special privileges that we get when we're responding to emergencies. For example, we get to park close to wherever the emergency is happening in most cases. In emergencies, we can contraflow or stop at a red light, clear the intersection, and go through. So we have a few special things that we're allowed to do. And there is really no reason to justify operating an ambulance unsafely. The most important thing is that you want to be safe and you want the roadway to be safe for the people around you. Regular cars, ambulances have laws and regulations that govern operation. So you need to have a valid driver's license. You need to be responding to an emergency in order for us to have those special privileges we talked about before. And when you're doing these things, you need to use your warning devices like emergency lights, horns, and sirens. You need to exercise due regard, which essentially says, I'm going to ask for the right of way instead of just take it. So when you approach a red light, for example, and you're on your way to an emergency, we don't just blow through the red light. We slow down, we clear the intersection, and ask everyone involved on the road, I mean, not verbally, of course, but we're going to make sure that everyone else has come to a stop, and then we are going to proceed through that red light. So it's more about an asking permission than a taking permission. And those are important. And then there's lots of other systems that provide additional operational guidance. Lots of ambulance services also use safety driving policies, which also help reduce accidents. And just like cars, we need to make sure that we maintain control of our ambulance. And possibly it's even more important with an ambulance because we could potentially have a patient in the back. One of the most common places, or actually the most common place for ambulances to be involved in a collision is at intersections. And for some reason, we just have trouble with this. A lot of times there are cars turning, and so there's a lane that gets blocked, and ambulances will collide with blocked vehicles. Pedestrians are especially susceptible to being hit by ambulances. So just be really careful. Make sure you clear all your intersections and drive with excellence. It's definitely important to be safe while we're driving, but it's also important to be safe when we're not driving. So when we're walking around our ambulance responding to accidents and scenes, it's important to make sure that we wear our high visibility apparel. So that means those super bright yellow vests with the reflective tape and Velcro and tearaway safety straps. It's also easy to forget that roadways are not the only place that we should be wearing these high visibility vests. We should also be using them any place where cars or other vehicles travel, like side roads, cul-de-sacs, also in parking lots. A lot of times people forget how important it is to wear these in parking lots. People are not paying attention when they're driving home or leaving the grocery store. It's super important that we wear these vests so we can give motorists extra time to notice us should they not be paying attention. Points for roadway safety: don't trust traffic around you. Don't turn your back to traffic. Okay, make sure that you wear PPE, and at night turn off vision impairing lights. Remember, when it's foggy, don't use your brights. Buy something without inspecting it first. So I would say you probably wouldn't use something without inspecting it first. And this applies to the ambulance as well. So checking the AC, the heating, ventilation, checking seat belts, making sure your radios work, that we have supplies, and unit cleanliness is super important prior to our shift. Crucial to make sure that we have the basic medical supplies that we need to operate. Imagine not checking to make sure you have the things that you need to have and showing up to an emergency and realizing that you don't have the tools that you need to save a life. So this list here is just a small list of things that are recommended for checkoff. About roadway safety, remember, we should stay 100 feet from any sort of wreck or burning vehicles and 2,000 feet from hazmat spills. Ideally, we should be uphill, upwind, up and away, however you want to put it. We need to be far away from those. We also need to keep in mind that the wind direction can change, so pay attention to that too. Transport is a valuable tool, but knowing when and how to use it is super critical for us to understand. We need to know that we will have operational guidelines to adhere to. Remember, this is going to be ideal for patients who need to go to a facility that's far away. Perhaps there's a prolonged extrication. We do know that air transport will save time over ground transport for critical patients in a lot of circumstances. Perhaps your patient's in a remote area or ground transport is completely blocked. Specialty medical skills, supplies, or equipment may also be available in air transport that's not available on ground transport. In regards to medical transport, there are some guidelines or some things we should look out for, some good reasons to call for air medical transport, and those things would include acute stroke, head injuries with altered mental status, chest or abdominal trauma with signs of respiratory distress or shock, any sort of serious mechanism of injury, or a patient with penetrating injuries. Remember, also patients who have severe injuries to delicate areas such as the hands, feet, face, and genitals. For air medical support, we want to remember that we also need to set up a landing zone, so avoid power lines, tall trees, towers, any other obstructions to the flight path. Make sure that the landing zone is clear of obstacles, obstructions. Make sure it's flat, free of debris, and at least 150 feet from any sort of vehicles. Make sure that during the day it's 60 feet by 60 feet, and at night it's 100 feet by 100 feet. Pay attention to wind direction and mark each corner of the landing area. 2 quick things to remember. Okay, make sure we don't approach by the tail rotor, and remember that the main rotor blades may dip down to as low as 4 feet off the ground. Generally, it's a good idea to just not approach a helicopter until a pilot or a crew member has motioned you to proceed. To make sure and approach helicopters from downhill direction, not from uphill. Let's switch gears and talk about hazmat. So hazardous material is any sort of material or substance that could pose a threat or unreasonable risk to life, health, or property if not controlled. So essentially, anytime that I eat ice cream because I'm lactose intolerant, that would make me a hazardous material. The principal dangers of this are toxicity, flammability, and reactivity. DOT has defined or classified 9 classes of hazardous materials, which include explosives, gases, flammable liquids and combustible liquids, flammable solids, spontaneously combustible and dangerous when wet, oxidizer and organic peroxides, poison or poison inhalation hazard, radioactive substances, corrosive substances, and miscellaneous. Any sort of vessel that carries a hazmat substance must have a placard on it for identification purposes. Here you'll see the number 1866, which is the United Nations code or number for this hazmat material. EA 704 hazmat classification. This is another way we can identify hazardous materials and how dangerous they are. So you'll see in that diamond we have 4 different colors and different numbers. So essentially, the lower the number, it goes from 0 to 4, the lower the number, the less hazardous the substance is, where 4 is like the most hazardous. So the blue square or diamond is for health hazards, red is flammability, yellow is instability, and then white identifies specialty or special hazards. So how do we identify hazmat? One of the ways we can identify hazmat materials is using our senses, but I really don't recommend this. You could use your nose to smell and identify a hazardous substance, but depending on how hazardous it is, you may only be able to detect it once. So look out for visual clues like wavy, colored vapors, frost near container leaks, weird odors, and typically if you smell or see something weird, retreat from the area, especially in areas like plants or industrial sites. Rescue can be dangerous, and really no one should be attempting hazmat rescue unless they've had training. If this happens and you stumble into a hazmat rescue, request help, locate yourself and bystanders uphill, upwind, upstream, and away from danger, and allow the people who are trained to do the rescues to do this rescue. Time that there's a hazmat situation, be aware that there might be a need for decontamination. Be familiar with your local procedures. So unless you're specifically trained to do this, again, don't worry about this. 60 to 90% of decontaminants are removed with clothing, and try to avoid cross-contamination. At emergencies, we have different areas that we identify, and inside each of those areas we perform specific functions. So the center area is called the hot or the contamination zone. This is where most of the hazmat exposure is located, and no one should be in the hot contamination zone except for those who have the proper PPE to be there. The surrounding area is the warm or the control zone. You still need to have PPE for this, but this is where decontamination is going to happen. And then the cold and the safe zone is essentially where treatment is going to happen. Remember, we don't want to allow contaminated patients to leave the warm zone into the cold zone unless they have been decontaminated, because then that contaminates the cold zone or the safe zone. That radiation emergencies are part of hazmat. There are specific guidelines for these types of emergencies. If an RSO cannot come to the site of a radiation emergency, remember we can place the patient in a body bag up to their neck, cover their hair with a cap or a towel, and then wipe their face with wipes, place them in a plastic bag for disposal at the hospital. Remember, the substance that you wipe from the face could potentially be radioactive, so make sure you let the hospital know that you may have radioactive waste inside of a bag, and they'll know where that needs to go specifically. Remember, time, distance, and shielding are critical in reducing exposure in radiation emergencies. Remember your priorities. The safety of rescuers, of yourself and patients is the priority. Make sure that you're doing patient care, and make sure that the right proper decontamination procedures are followed. Here you'll see some radiation hazard labels. Radioactive white 1 is going to be the least amount of radioactivity or hazardous radioactivity level. Yellow 2 and yellow 3 just increase the likelihood of injury and the amount of radiation. Radiation exposure can cause radiation sickness, which essentially comes from large amounts of radiation. So symptoms can start from a few hours to days following the exposure, and depending on how much the patient was exposed to, can last a few days to even 7 or 8 weeks. Typically, we'll know how bad a reaction they're going to have, how bad their symptoms are going to be, based off of how quick the symptoms present themselves. So if they start vomiting very quickly after exposure, the likelihood of having a positive outcome has been greatly reduced. Victims of radiation generally are not contagious and they're not infectious and typically won't endanger you. You're at risk of becoming contaminated if the person still has particles on their skin or clothing, however. So keep an eye on those signs and symptoms, which include hair loss, burns, and generalized skin lesions. With radiation emergencies, make sure you have protection, okay? And factors that determine your exposure level will vary based on the amount and type of shielding that you use, the strength of the radiation source, or the alpha, beta, gamma rays, distance from the radiation, the type of radiation, how long you were exposed, and the amount of your body that was exposed to the radiation. Lots of factors. So the creation of a lot of illicit drugs falls under hazmat as well. Because if you think about it, a lot of these circumstances where people are operating clandestine drug facilities, they are just dumping chemicals into sometimes a bathtub or a bucket, and that's going to produce noxious fumes. So it's very dangerous. So keep that in mind when you enter these scenes. Things like phosphorus, sodium hydroxide, anhydrous ammonia, and hydrochloric acid can be present. These things can produce gases like phosphine, which is extremely toxic and even in small amounts is incredibly dangerous. As harmless as marijuana can be, remember too that in large marijuana growing operations, oftentimes there's large amounts of fertilizer storage, and with large amounts of fertilizer increases a likelihood or a risk of a big accident or explosion. Let's talk about MCI. So mass casualty incident is any event that places excessive demand on your local system and typically involves 3 or more patients. So does that mean if you have 5 patients that you have an MCI? Not necessarily. Anytime that you have less resources than you have emergencies, you can consider or classify that as an MCI. So remember, it's better to call too many people than not enough, and be familiar with your local disaster plans ahead of time. NIMS is a system we use for managing MCIs. It provides a consistent approach. The ICS system is part of NIMS, and it provides for flexibility and stability. If we all do a project together and we do that project the same way every time, it allows that project to be much more organized, and we can finish projects quickly together when we know what our job is and how to do it. And that's what NIMS allows us to do. In NIMS, you have different branches, which will be your command system, which will have sections underneath them like finance and administration, logistics, operations, and planning. And under each one of those are different workers with different jobs assigned to help fix the situation at hand. Is a chart just illustrating how that layout would work. Obviously, incident command is at the top and people report to incident command. But if you look, for example, under operations section, you'll see hazmat, police, fire, and EMS. You don't see a diamond for each one of those that links itself to incident command. If you have too many people talking to the incident command, things get crazy, communication becomes difficult. So the people underneath those diamonds report to the diamonds, and then the diamonds report to the rectangles. It allows communication to be quick, easy, and organized. Okay, here is the EMS branch organization for any major incident. Obviously, there's an incident commander at the top, and flowing downwards, we divide them up into subcategories, and then the subcategories have personnel working for them as well. Remember, for NIMS, responsibilities of the units may include triaging, treatment, transport, staging, and morgue units. Anything to function properly in an MCI, we need to know how to triage people. And very simply put, this is defined as our ability to place a priority on patients in order for us to ascertain who needs to be treated first. Triage is done by the first EMS crew and is conducted at the incident site. They get a colored tag that shows where their classification is, and they're removed from the incident site. They go to the triage unit where they are triaged again. To be familiar with the START triage system. It's a system that uses colors to identify priority. It's used for anyone older than 8 years of age or who weighs more than 100 pounds. Each patient should be triaged in less than 30 seconds. We're going to look at their respiratory status, perfusion, and mental status. Remember the mnemonic RPM. First category, easy. It's green. If you can walk, you're green. It doesn't matter if you have someone walking towards you that is missing an arm, has a glass shard stuck through their eye, and a briefcase that says $1 million for the first person who helps me. There's still a green tag because they're able to walk. You'll see the START triage system. This functions like an if-then chart. So respirations, if yes, then we'll perform this action. If no, then we perform this action. And that will help you decide what color your patient is. You'll start from the top and move your way down towards the bottom. This is what we use for children. Remember, we're going to assess them based on RPMs as well. And this is for anyone who appears to be a child. System is very similar to START triage. Remember, the colors are going to be different here. They're labeled red, brown, green, and black. And essentially all we do is follow the chart from top to bottom. And that will help us determine the priority of our pediatric patients. Here is a visual that just shows the different colored tags, example of what they would look like, and some of the priorities that would make them fit in these categories. Pause your video here if you'd like to read more or see more about that information. Mass destruction. Of course, I only hope that we never have to deal with this. But remember, there's different types of weapons of mass destruction. The mnemonic CBURN will help you remember: chemical, biological, radiological, nuclear, and explosive. Here's the Be Nice mnemonic, and that stands for biological, nuclear, incendiary, chemical, or explosive. Explosives and incendiary devices are the most common types of weapons of mass destruction. This includes explosives, which we all know what explosives are. Fuel is ignited, the air pressure around it rapidly changes, and it produces a shock wave. in all directions, and it can cause blast injuries. Of improvised explosive devices, often these are created from easily obtained products. So think about the Boston Marathon. The explosive devices there were created from pressure cookers, and they had put nails and shrapnel in them. Vehicles can become improvised explosive devices. Remember car or truck bombs? Commonly use an explosive called ammonium nitrate in fuel oil. Explosives that have different effects, and where you are in your proximity to the explosion will determine what type of injuries you might sustain. So the first is called primary, the second is secondary, and then tertiary, quaternary, and quinary. The explosion is primary. Secondary effects result from flying debris. Tertiary effects are injuries produced by the propulsion of your body. And then quaternary effects include burn, crush, and inhalation. Quinary effects include environmental exposure, so radioactivity, fuels and metals, and things like that. Be cautious of secondary undetonated devices. Most of the time these are going to cause burns. So remember, use your rule of nines, pay attention to airway breathing, and dress your burned areas. Agents are dispersed in a variety of ways, including aerosol devices. This is an important key term to remember. The word is volatility, and the definition of this is its tendency or its ability to evaporate and create a vapor. That's volatility. And agents that don't evaporate are called persistent. Pause your slide here to read about the different chemical agents that we're about to talk about. Nerve agents are very powerful and easily made, and essentially they overstimulate the muscles, smooth muscles, and glands and nerves, causing us problems. Problems can include respiratory failure, paralysis of respiratory muscles, lots of airway secretions. We want to remember the mnemonic SLUDGEM, so that's salivation, lacrimation, urination, defecation, gastric distress, emesis, and we left one off, which is called meiosis. And meiosis is the constriction or extreme constriction of pupils. Nerve agents will include monitoring ABCs. We do have medications that can help, which are atropine and pralidoxime, which are antidotes. If there are seizures, benzos can be used to eliminate those. Another type of chemical agent is a vesicant, which causes blistering, burning, and tissue damage. Agents include sulfur, nitrogen mustards, lewisite, and phosgene oxime. Vesicants, we're going to look for burning, redness, blistering, and necrosis, stinging, tearing, and development of ulcers in the eyes, shortness of breath, wheezing, edema, nausea, vomiting, and fatigue. Care for vesicants should include irrigation, managing any chemical burns. Remember, dry sterile dressings. Lewisite is an arsenic-based agent, has an antidote called dimercaprol. Cyanide has a bitter almond smell, and it disrupts the ability of our cells to use oxygen. It can be inhaled and ingested, and with high dose, death can occur in as little as 6 to 8 minutes. Very dangerous. Look for anxiety, weakness, dizziness, nausea, muscle trembling, tachycardia, tachypnea, apnea, seizures, coma, pale, cyanotic, or sometimes even normal colored skin. Cyanide by managing the airway, breathing, and oxygenation. There are antidotes available, so nitrates and sodium thiosulfate and hydroxycobalamin as well. Sometimes these are hard to come by though. Pulmonary agents, which include phosgene and other halogen compounds, and nitrogen-oxygen compounds, and these act primarily to cause lung injury. Pulmonary agent exposure, look for tearing and runny nose, throat irritation, dyspnea, wheezing, coughing, crackles, stridor, and secretions. These agents include managing airway and breathing, being prepared to suction and administer oxygen, and then beta-2 agonists such as albuterol can be given for wheezing. Activate ALS for this, and you definitely should be prepared to manage the airway. Toxic industrial chemicals and the way that we treat and approach them will depend on the agent involved, and there are far too many to go over individually. For nuclear weapons and radiation, there are 3 mechanisms of death, primarily radiation, blast injuries, and thermal burns. Radiation is defined as energy released from radioactive atoms, which pass through and change the structure of the molecules in our cells. Primary exposure is radiation injuries that occur during or shortly after detonation. And then, of course, after detonation, there is what's called fallout, which is radioactive dust and particles that can be life-threatening to people far from the epicenter of the detonation. Nuclear weapons cause blast injuries, rapid heating of air, rapidly expanding gas cloud. The injuries are the same as those from conventional explosives, and the wind blasts can reach up to 160 miles an hour. So remember, 160 miles an hour is pretty powerful, so expect objects to be thrown for great distances. Thermal burns are the type of injury that caused the most deaths from nuclear explosion. Heating is a short duration, but it's very intense, and eyes can be damaged from the intense light. It's conventional explosive devices that have radioactive materials in them. These pose a risk of widespread radiation illness and contamination of the environment around it. Radiological exposure devices differ from dirty bombs because they do not use an explosive to disseminate radiation. Nuclear weapons and radiation, remember, most destruction and death is nearest the center of the blast. There is less death and injury the further you are from the blast. So we want to identify the time after exposure that the patient complains of any radiation-related signs and symptoms, because the closer the symptom is to the exposure, typically the worse off the patient is going to be. We'll look for are going to be nausea, fatigue, malaise, which is just essentially a general feeling of illness, and clotting disorders. You might see vomiting, loss of appetite, diarrhea, fluid loss, reddening of the skin, rapid onset of incapacitation, cardiovascular collapse, confusion, and burning sensation. It's definitely not something that you want to go through. Emergency medical care for nuclear weapons and radiation includes protecting yourself and patients from further radioactive exposure, so use necessary PPE. And remember, if you are not trained in radiation rescue or intimately familiar with the risks of radiation exposure, probably best to leave this to a radiation safety officer. You are potentially could suffer thermal and blast injuries, so manage airways, breathing, and oxygenation. Iodine tablets can help protect against long-term effects of radiation. So that ends our Module 10 review. I hope that you learned something, and of course, if you have any questions, make sure to reach out to your local instructor. Thanks.